My name is David Chase. I am the California Outreach Director for Small Business Majority. Small Business Majority is a nonprofit and nonpartisan small business advocacy organization. So we are working with policymakers, both at the state and the federal level, to make sure that the voices of small business owners, the concerns of small business owners, and the opinions of small business owners are really being heard, whether it be up in Sacramento, where I'm based, or out in Washington, D.C., and trying to work with policymakers as they try to craft policies that are going to impact the economy, impact small businesses, to make sure that they understand the needs that the small business community is facing and the challenges that you all are facing. And in order to do that, we do a lot of opinion polling of small business owners. So across the country, we do scientific polling, not just asking our own members, but just doing it scientifically, asking small business owners across the board about challenges they're facing, their opinions on some of the bigger policy issues that are being debated right now in Washington. And we use those results to inform our elected officials about the small business community and work with them to implement policies that are going to hopefully benefit the economy overall and in particular small businesses. Time and time again in those polls asking business owners what the biggest issues are facing their business, healthcare costs continues to be one of the top issues in all of our polls. The top issue or one of the top issues. So why is healthcare reform such a big issue for small businesses? For those of you that run and work for small businesses, none of this is going to come as a surprise to you all that the healthcare costs have been going up recently. Over the past decade, small business owners have seen their healthcare cost double. Healthcare costs are going up a lot faster than inflation, about 5 times actually faster than inflation. So it's something that's really an economic challenge to small businesses. And small businesses, interestingly, pay about 18% more on average for healthcare than bigger businesses do. So that's a real competitive disadvantage for a small business that is competing for workers, competing for customers, with a large business. If the big guy is getting, 18%, 20% off on his healthcare, it puts your small business at a real competitive disadvantage. This is also a big issue for the self-employed. So here in California, close to 30% of the self-employed businesses of just one person are uninsured. So they don't have insurance, through their own business, which they're running. They don't get it through a spouse. They don't get it through, a public program like Medicare, Medicaid. They're uninsured completely. And that percentage, that 29.5%, is more than double the rate for the population as a whole. So in other words, the self-employed are more than twice as likely to be uninsured compared to anybody else. So, when we think about who the uninsured are, in many cases it's actually people out, running their business. And for small employers, people that employ themselves plus other folks, they're not doing too much better. So a quarter of them are uninsured as well. So this is something that really does impact people running small businesses. In addition to the opinion polling that I've mentioned that we do, we also have done some economic studies. We did this a few years ago before the federal healthcare reform law was enacted, looking at recent healthcare trends, wanting to do a projection what would happen to healthcare costs over the next decade, assuming that we just kept everything the same. So let's assume there's no healthcare reform. We just keep everything the status quo. What are small employers going to see happen to their healthcare costs over the next 10 years or so? And the results of that economic analysis show that by 2018, healthcare costs would have doubled again for small business owners. So that was sort of the road that we were going down, if you will. And so, the opinion polling and events like this that we were doing with business owners at the time said, hey, that's not going to work. That's unsustainable. We need to do something to change tracks because this, by 2018, another doubling is not, going to work for them. This is a snapshot of one of the opinion polls that I mentioned. This one is of California small businesses, asking businesses both that do provide insurance and that don't provide insurance. The top graph shows you of businesses that do not provide insurance, we ask them why. So what's the number one reason why you don't provide insurance? Is it because your employees don't need it, or they get it somewhere else, or it's just not a priority for you or for them, or is it because you can't afford it? And 86%, overwhelmingly, that was the top response, said, we don't offer insurance because it's just too expensive. That was the number one barrier for employers offering. And then, interestingly, of businesses that actually do provide insurance, 70% of them said they can barely afford insurance. So they're offering insurance, but are really struggling to afford it because the costs, keep going up and up and up. So you can see it was really an issue, for businesses that provide insurance and those that don't. So we'll change gears now here and sort of start to dive into the federal healthcare reform law, which was enacted back in 2010. It's a massive law, hundreds and hundreds of pages. There's dozens of provisions in there that impact sort of all walks of life. But over the next hour or so, we'll try to just dive into a few of those provisions that impact small business owners, small business employees. So first topic is the small business tax credit. So this was part of the 2010 healthcare law, and it took effect immediately. So this particular provision has been around now for a few years. Other provisions that we'll talk about later, some of them have kicked in, some of them have not kicked in. The law was sort of rolled out in different stages, but this piece was one of the first things to get kicked in. So basically, it's a tax credit for employers that offer insurance to their employees. It helps them sort of pick up some of the cost of the healthcare. So to be eligible, there's three things to keep in mind. Number one, this is for businesses with fewer than 25 full-time equivalent employees. Average wages of those employees needs to be below $50,000, and then the employer needs to be paying at least half of the expenses in order to qualify. So you can see it's really sort of targeted towards the smaller businesses, which traditionally have the toughest time affording coverage. So the way it works is the credit is on a sliding scale. So the businesses that are on the very small end of the scale in terms of the number of employees they have and the salary of their workers will get up to 35% of the employer's expenses. Up to 35% will be covered through this tax credit. And then as your business grows, both in terms of the number of employees and their salaries, then your that percentage shrinks. So again, it's really targeted towards the smaller businesses, and then your percentage drops off there. So it goes somewhere between 0 and 35%, depending on the size of your business and the wages that your employees earn. And that goes back from 2010 until this year, until the end of this year. And then starting next year, the credit actually gets kicked up to cover up to 50%. So it'll become a little bit more valuable next year. And that's been around since 2010. If you didn't know about the credit, you can still claim it retroactively. So don't feel like you've missed out on something if you didn't know about it. A couple other things to keep in mind: the credits cannot be claimed by, they don't cover the expenses of the business owner or their family. So this means that when you're counting up your employees and you're trying to stay below that number and you're calculating your average salary, if you're the business owner or if you have family members that work for you, you don't count them. So you don't count yourself, you don't count your spouse or whatever if you have your spouse employed. So you don't include those people, including yourself, in that calculation. And then lastly, the credits cannot be claimed by the self-employed. So this is just for businesses that employ other people. This is another one of the economic studies that we did that I mentioned. We did this last summer. Looking at this tax credit, we wanted to know specifically how many small businesses in California would be eligible potentially for this new tax credit. So you can see that over 70% of the businesses in the state potentially qualify, meaning their business is the right size and their employees make the right amount of money. Some of them offer insurance and are probably getting the credit. Some of them don't offer insurance and so are not getting the credit. But that sort of gives you the potential number that's out there. And you can see most folks get about 60% will get somewhere beneath 35%, and then just over 40% will get the maximum 35%. Moving on to the next topic is grandfathering. So when the healthcare law was being discussed back in 2009, 2010 in Washington, we heard a lot from elected officials back there that if you like what you have, you can keep it. And so the promise was, or the premise was, if you like your doctor, you don't change doctors. If you like your insurance plan or insurance company, you don't have to change. So folks that already have an insurance product and say, hey, I want to keep things where they are, you get to do that. So that plan, if it was already in place, is considered grandfathered. And so a lot of the reforms that are in the new law, the grandfathered plans are exempt from some of those reforms. Not exempt from everything. So if you have a grandfathered plan and you want to know sort of, well, which new requirements is my plan exempt from, which ones is it not, talk to your insurance broker, whoever you're working with, to get your benefits. Or there's a lot of websites, including ours, that can give you sort of the breakdown about here's all the new features of the healthcare law, and here's what the grandfather plans have to comply with. Here's what the ones that they don't, and give you sort of that breakdown. And then another thing to keep in mind is if you have a grandfathered plan, if you like what you have and you're keeping it, what does it really mean to keep your plan? And there's a breakdown about sort of the changes that you can make to your grandfathered plan without jeopardizing your grandfather status. So basically the point is, if you like what you have, you don't have to change anything. So next topic is shared responsibility. There's a shared responsibility provision for larger businesses, but small businesses are exempt. So businesses with 50 employees or fewer under the healthcare law are not required to offer insurance to their employees. And there's no penalty or tax or fee or anything for not offering. So if you're 50 or smaller, you get to, it's basically just like it is today. If you want to offer insurance, that's great. If not, that's your choice. So there's no mandate or penalty or anything if you're 50 or smaller. And 96% of all businesses in the country are 50 or smaller. About 80% are 10 or smaller. So there's not a whole lot of businesses that are at 50 or even close to 50. You can see, there's 4% that are in that ballpark. And almost all of them already offer insurance today. So there's a very small section of businesses. You can see, it's like 0.1% of businesses that don't offer insurance today, but may be paying a penalty in a couple of years if they don't offer insurance. I'll talk more about that in a second. Not trying to downplay it, but just sort of put it into perspective. There's not a lot of businesses that are in that category. If you happen to be one of them, then this is something you're going to want to care about. Mostly it's a lot of chain restaurants. If you own 10 Denny's, then you're going to have more than 50 employees and you probably don't offer insurance. So those are the sort of franchisees that are sort of falling into that category. So how do you count your employees when you're trying to figure out, am I below 50 or above 50? So full-time employees are easy. They're just counted as full-time employees, and this law, this particular provision defines a full-time employee as working 30 hours or more. So it's not the traditional 40. They've changed it for some reason, and now it's 30 for this provision. So if you've worked 30 or more, that counts as one full-time employee. Part-time people are counted differently. A part-time person is someone that works at least 15 hours a week. Basically what you have to do is you add up all the hours that your part-time people are working and you divide that by 30, and that will give you your full-time equivalent for your part-time people. So to keep a simple equation, if you have 2 people working 15 hours a week, that counts as one full-time person. So when you're counting your people, you don't just count heads. You might have more than 50 people working for you, but the way you actually count people, you may have fewer than 50 FTEs. You can see here the example. So, you have 40 full-time people, 40 people working, 30 hours or more, and you have 20 people working total hours of 400. You divide that by 30, and that equals 10 full-time people. So you have the 40 full-time plus the 10 equivalents equals 50 FTEs.